All right. Hi, Mr. Jonah. I'm just going to go ahead and put some hand sanitizer on. I'm going to shut the door so we have some privacy. There's good lighting in here. Would you mind telling me your name and birth date? Oh, great. So I'm Lainey. I'll be your nurse tonight. It looks like there's been an order placed by your physician to have a peripheral IV placed. And what that will do is any labs that we need to, pull blood from, any medications or IV fluids that will need to be administered to during your hospital stay will go through that IV. So that's why it's necessary. Have you had IVs before? You have? Okay. So what are some experiences you've had with that? Oh, they make you nauseous? Okay. Well, something that we can do during the procedure is to have you look over at that wall while I actually put the needle in. And also afterwards, I can cover up the IV site with Coband, and that way you won't have to look at it, okay? All right, and so if you have any questions or concerns or anything like that, please let me know because I'd be happy to address them and talk to you about it, okay? And then also during the procedure, yeah, I'll have you look at the wall and then also just deep breaths. I feel confident performing this procedure and everything will be okay. All right, so I'm just going to assist you into low Fowler's position. It looks like you're pretty much there, but I do want you just a little bit. Yeah, there we go. Okay, so do you feel comfortable with us proceeding? Okay, and I feel that this is appropriate for my patient, so I don't think that anything contradicts me placing this IV today. So I've gone through my nursing considerations. All right, so I've gathered my equipment. I have it here in the room with me. I'm just going to teach my patient a little bit about how an IV works. So Jonah, I'll insert the needle and then I advance a catheter into your vein and I actually take the needle out. So a misconception with IVs is that a needle will stay in your arm, and that's how it worked in the olden days. But luckily we have a bendy plastic catheter that will be in your arm, okay? All right, so first I'm just gonna move all my equipment here over to the bedside table. Okay, great. All right, so you probably know how this works, but I'm just gonna put a tourniquet on your arm. And, oh, and also, Jonah, do you have any allergies that you're aware of to like Tegaderm or tape? No? And in the past when you've had IVs, did they become irritated? Okay, no. So it doesn't sound like you have any allergies, and your EMR doesn't indicate that you have allergies either, so that's good. Okay. So here's this little tourniquet. And looking at your arm, you do have some good veins that I can see. But something the tourniquet does is it helps those veins pop up and become more visible, and it also helps the catheter go in a little better. Okay, so I just got to make sure that that's good and tight here. And you can even see and feel. You don't have to if it makes you nauseous, but yeah, see, that's a good vein. Okay, perfect. So I'll take that off while I prepare my supplies, but that's kind of how I assess for a vein, okay? All right, perfect. So I'm just going to open my equipment using aseptic technique. I just want to be really mindful of this procedure because it is something where I'm putting a foreign body into my patient's arm, and I want to make sure that they're clean and safe, and that because there is a risk of infection with this, and I want to be really mindful of that. Okay, so here I'm just gonna make sure that my flushes are connected and that everything is ready to go when I get that insertion done. So here I have my flush. You can see there's a little air bubble at the top. I'm just gonna go ahead and get that out. Perfect. Here my little head block. So this is sterile, but I always like to disinfect because you just never know. Great. Where did my flush go? Oh. Okay, so here I have that ready to go. I am just gonna flush my line. Perfect. So that's all ready to go. All right, so I've assessed for an appropriate vein. In doing that, I want to place the tourniquet about 3 to 4 inches above where I plan on poking. So I'm going to go ahead and do that. Then after I apply the tourniquet, it is something that is tight and stops that blood flow. So I want to make sure I can still feel radial pulse. Okay, yeah, so that's present. And I'm just feeling again, great. So I'm going to go ahead, scrub this for 30 seconds. And then also, once I have it scrubbed, I don't want to touch it again with my bare hands or anything like that, because I want to keep this clean. Because like I said, I'm inserting something into my patient's vein. Okay, so while that dries, I'm going to go ahead and perform hand hygiene again and put on some clean gloves. And I want to be quick because I don't want to leave that tourniquet on my patient's arm for very long because it is uncomfortable. All right, so are you still feeling okay, Jonah? All right, so I know you've had this before. Let's have you look over at that wall. This is a big poke, as you know, but please just practice some deep breathing for me and everything's going to be just fine. All right, so I just got my bevel up here. Okay, big poke, Jonah. Okay, got flash. So now I'm just going to go ahead and advance that catheter we talked about. Okay, and after I advance that catheter, I do want to find the end and hold it. We are just going to drip a little bit of blood. I'm going to put that in my sharps container. It's okay, it'll just bleed a little bit, that's all right. All right, just doing my best to put pressure. Okay. Ooh. Oh my gosh, John. That is a good vein. That is a great vein. Sorry about that. Just don't look at your arm. It's a good thing I had you look away. Everything's all right. Okay, while I'm still holding that, I'm gonna go ahead and flush once more. I'm gonna go ahead and flush 5 mils. But at least I know it's a great vein. It's got great perfusion. I know it'll be just great when I administer medications and everything else. All right, so that is placed. And where did my tegaderm go? Okay. And while I was doing that, I held the skin taut. I just made sure that it was an appropriate site and really was mindful of that, while not touching the site that I had disinfected, of course. Okay, so I'm just going to go ahead and place that tegaderm on. The biggest things with this procedure is you need to be clean and cautious, because once again, you're introducing something new to their blood flow, and I want to keep my patient safe as possible. And I think we did a good job of that today. So I'm going to tape right here. And another thing to be mindful of, Jonah, is please let me know if it becomes really sore and irritated, and if you just can't stand it. And we'll take a look at what we can do. And that's the same as, like, if this is in the way while you're showering or whatever you might do when you're washing your hands and all that, please let me know. And I want to make sure that you feel comfortable, okay? So I'm just going to go ahead and place another piece of tape here. Okay. And I am going to clamp this as well because it's not in use right now. Yeah, and this tape doesn't want to stick to your skin. Alrighty. Okay, Jonah, so I'll document all of this. I'm really glad. I feel like this procedure went well today, so I'm going to indicate that in your chart. I'm happy that you're still feeling good. But if you have any questions at all or concerns, please let me know. And this will really help during your hospital stay so we can safely administer medications to you, okay? So I'm just gonna clean all this up and document my procedure, and be sure to perform hand hygiene on the way out. And I'm gonna monitor this this site because I don't want it to become inflamed. And he knows to tell me if anything becomes abnormal with that. So yeah, I'm just gonna throw everything away, perform hand hygiene once more, and make sure to document everything. Thank you.